Good afternoon, fellow Rotarians. It's my pleasure to be here today to celebrate the 70th anniversary for Yakima Valley Memorial Hospital, Virginia Mason Memorial, June 1950 to June 2020, 70 years of serving the community. For 42 of those years, I called Memorial my second home. Now I have the honor, and indeed the task, through a story told as a narrative history consisting of 10 short chapters, to take 70 years and compress them into 30 minutes. That is like taking a 1,000-page epic novel and reducing it to a 3-line haiku poem. I'll give it a try. Known over the years as Yakima Valley Memorial Hospital, YVMH, Memorial Family of Services, Virginia Mason Memorial, VMM. During this story, I will only be using the title Memorial. The sources for this story are the Board of Trustees records and my personal notes of happening each of those 42 years. I must admit, I have left out thousands of names of those people who were main characters in the story. For that, I truly apologize to those heroes. I trust they will understand and accept my apology. So, sit back, relax, as I tell you the story I call The Process of Becoming. Prologue. I first met Memorial when she was only 22 years old. I had been invited up from California by then CEO Max Hunt and the Board of Trustees as a candidate for the vice president position. Max was nearing retirement, and the board was actively involved in succession planning. My 2-day stay left me with these impressions of Yakima Valley Memorial Hospital. She had a warm and welcoming personality. She had a comfortable and engaging style. Her values were solid. Her focus was upon her community, and I liked her parents, the Board of Trustees. They were personable, engaged, intelligent, and they had 2 very attractive characteristics: an optimistic attitude and an adventuresome spirit. 2 characteristics which I would learn over time are the bedrock of an agricultural community. As I returned to California after my interview, I reflected upon Memorial with a metaphor. The metaphor of a diamond in the rough played in my mind. This relatively young organization, which is very important to the fabric of the greater Yakima area, could, with the right amount of attention and affection by many, be crafted facet by facet into a very special and precious community gem. What follows is a story of Yakima Valley Memorial Hospital, Virginia Mason Memorial, and at the same time, a story of Yakima. It is a story of conscientious and courageous people who take bold steps to create and grow a vital community organization that exists to better the greater Yakima area. Chapter 1, Never Doubt. The cultural anthropologist Margaret Mead is noted for her keen observation. Never doubt what a small group of dedicated people can accomplish. In fact, it could well be the motto for Yakima. It was a small group of dedicated people who made the rebuilding of the Capitol Theater happen, who created Yakima's Town Hall series, who started Pacific Northwest University, who fashioned United Good Neighbor, the precursor to United Way, who built the White Pass ski area and the Yakima Tennis Club, who started Heritage University, who created the Greenway and Cowiche Canyon Conservancy, and who formulated the plan to create Yakima Valley Memorial Hospital. Shortly after World War II, there was a dangerous shortage of hospital beds in the Yakima Valley. The Sisters of Providence, which had been in Yakima since 1891 and had hospitals in several other communities in the Pacific Northwest, was the sole hospital in Yakima. The Sisters of Providence had not announced any plans to expand in Yakima. They most likely had many demands for new and expanded facilities in other communities, and a Yakima expansion would just have to get in line. So, over a cup of coffee, 3 young men made a pact to do all they could to bring a modern hospital to the Yakima community. George Martin, attorney, Don Keith, funeral director, and Ed Mueller, accountant, took their dream to Jim Bronson, director of Boise Cascade, and Ernie Kershaw, an orchardist. With determination, these 5 men soon grew to 16 dedicated community leaders who banded together for weekly meetings to explore the possibilities of building a new hospital. Articles of incorporation were filed in May of 1944 by Carol Hall, Ernie Kershaw, Jim Bronson, Charles Holtzinger, Frank Stubbs, Lyman Bunting, Cliff Ross, Fred Plath, Ralph Sundquist, N.K. Buck, J.D. Keck, George Rankin, Don Keith, C.W. Halverson, Ed Mueller, and George Martin. The small group decided to test the public's attitude by asking for financial pledges towards the proposed hospital. A weekend was selected and they went into the community. In only a few short hours, the report was in. $180,000 had been pledged. The people of Yakima wanted another hospital. The seminal decision was made. A key element of that fundraising was the donation by Charles Holtzinger of the 7 acres for the building site. The site was dedicated in 1947 by the Honorable William O. Douglas, Justice of the United States Supreme Court. Construction began May of 1948, and the doors opened June 20th, 1950. The creation of an acute care hospital was an enormous undertaking. What surpassed that achievement was something deeper, more significant, and everlasting. It was the creation of an unwritten contract with the community. It was a contract not imposed by any entity, neither city nor county government, nor shareholders, nor financial entities. It was self-imposed. The unwritten contract committed Memorial to be a healthcare shepherd of this region. This narrative story will shed light upon how Memorial has been all in for the long term in this vital role. For 70 years, Memorial has been the beneficiary of ideas and products of many, many group efforts. As the story unfolds, you will recognize that the effort by a small group of dedicated people is a core element in Memorial's history of becoming. Chapter 2, Women and Memorial. The creators of Memorial were not only dedicated, they were wise also. They understood that to get something done, and done well, they needed to involve women. The history of women's involvement with Memorial goes back to the mid-1940s. The involvement has been and remains extensive and very significant. To have a memorial hospital, donated monies were necessary. Enter the women from our community. Literally, hundreds of women came together informally in 1948 to have fundraising events like bake sales and bazaars and teas and something called Operation Coffee Cup. In 1949, that which was informal became formal with the establishment of a very effective and productive women's guild system. The first guild established was the Florence White Guild. It is still alive and thriving 71 years later. What followed over the next several years was the creation of an elaborate and powerful network of 20 women's guilds. These guilds were a voice into Memorial leadership and a voice about Memorial out to the community. Also in 1949, through the efforts of Geraldine Guy, a Women's Auxiliary and Volunteer Services was formed. With the opening of the doors of the hospital planned for June 20th, 1950, the hospital found itself short of support staff for the professional staff. Enter the women. Only with the help of 200 plus women volunteers was the hospital able to safely open its doors and serve patients until the full-time employee base was hired. Today, that same volunteer program is one of the largest and most active programs in the state. Memorial's relationship with women is extensive and significant, as witnessed by the following. Obstetrical and women's medical and surgical services are one of the most important and highest volume services of the Memorial's provides. 80% of Memorial's employees are women. 2/3 of the manager level positions are women. 60% of top leadership are women. Women are the main customer of the hospital. They are typically the decision maker for healthcare matters for their family. They decide for themselves, for their children, for their parents, and for the man in their life. It should not surprise you that when I personify Memorial, I use the pronoun she. Chapter 3, A Y in the Road. Fast forward to 1982. For 32 years, Memorial had served, along with St. Elizabeth's, as an acute inpatient care hospital. During the early 1980s, transitions were occurring in healthcare. Acute inpatient care was still needed, but recognition was emerging that our community's healthcare needs were more than that. At a Board of Trustees retreat in 1982, the leadership faced the proverbial Y in the road. Would Memorial remain just an acute care hospital, or would horizons be expanded? Would she step forward to meet the many other healthcare needs that existed in the community? Mindful of its unwritten contract, the Board of Trustees made the second seminal decision in Memorial's history. Memorial would take a new path. Memorial would move towards being a more comprehensive healthcare provider. The strategic direction to become a vertically integrated organization has resulted over the last 38 years in the addition of such services as outpatient children's programs, outpatient cancer programs and services, diabetic programs, home health, hospice, pain relief medicine, sleep medicine, outpatient surgery centers, mother-baby programs, parenting programs, outpatient imagery services, long-term psychiatric care, spine rehab services, health education in elementary schools, just to name only a few. Many new programs, services, technologies, and facilities developed. Many creative people were involved. All were armed with their own proverbial hammer and chisel to craft many new facets on this diamond in the rough. Memorial was in the process of becoming a gemstone. Chapter 4, A Partner is Born. When asked, is Memorial a social institution or a business? The response always has been and always will be, yes. Frankly, the new programs and services that were created were financially projected to be low margin or no margin entities, a condition that would typically be a non-starter if Memorial considered itself to be only a business. But she does not. She had to look beyond only the financial aspects because the needs assessment clearly indicated such programs and services were needed, and there was an unwritten contract to be honored. Revenues from inpatient services would not be enough to sustain the programs, so a new source of funds was needed. In 1990, the magical Memorial hammer and chisel were put in the hands of Ann Caffrey to craft the Memorial Foundation, with its purpose to raise friends and funds for the new programs and services. And has it ever? Since its inception, over $65 million has been contributed and used. In addition, close to $16 million has been raised and used for building a children's village and cottage in the meadow. Without these funds, there would be no children's village or cottage in the meadow. The Memorial Foundation has been and is one of the most respected and trusted fundraising organizations in Central Washington. It doesn't just accumulate dollars, it puts those dollars to good use quickly. The Memorial Foundation, a powerful partnership that has worked together to fulfill the unwritten contract with our community. Chapter 5, The Glacier Called Memorial. Just as the glaciers of Mount Rainier, with their constant movement, daily shape the contours of that massive mountain, so too, Memorial, like a glacier, is in constant movement, shaping the healthcare topography of our region. Each movement is a response to increased volume, or the introduction of new services, or more space for new technology, or the change in the medical model. A look back shows that the Memorial Glacier has had 26 major shifts, let's call those construction projects, over its 70 years, 13 on the main campus and 13 at other sites throughout Yakima. On average, every 4.5 years, the glacier has a major event, shaping the contours of Yakima's healthcare topography. In between, it is inched along with hundreds of remodel and renovation projects. It began with a 6-story Y-shaped building. Several 2-, 4-, and 6-story additions have changed the original footprint. At the age of 45, and after heavy usage, Memorial was more than ready for a complete refurbishment of all patient rooms. Each patient floor was gutted, remodeled, and put together for many more years of service. Other major construction projects over the last 2 decades have changed the healthcare topography, like Children's Village, North Star Lodge, Water's Edge, Lakeview Spine, Ohana, Cottage in the Meadow, and various medical office buildings. All this activity over 70 years financially represents about $115 million in book value for buildings on Memorial's balance sheet. The high level of investing back into facilities is not the ordinary. The $115 million has mainly gone into construction, and thus to local contractors and subcontractors. This represents a significant amount that has stayed in our community and added to its economic health. The glacier called Memorial will continue to be in movement because the forces which create the movement will still be there. Chapter 6, Everywhere I Look. It all began with 7 acres of land, which was located way out west of downtown. For 40 years, this was the only campus. In the early 2000s, Memorial began purchasing property around the existing 7 acres for the future growth of the hospital. With the help and the support of her neighbors, the 7 acres of the main campus became 27 acres, and with it, a mutually agreed upon master site development plan for the future. This plan, besides the master plan for the airport, is the only other plan that exists with the city of Yakima. Meanwhile, with sensitivity to the beautiful residential setting that her neighbors have created, and focusing upon making her services and facilities more convenient for access, Memorial dispersed other facilities throughout Yakima. In addition to the main campus on Titan Drive, new campuses have been developed. On the North Campus, we have Children's Village and North Star Lodge. On the Almond Campus is Cottage in the Meadow. The Lake Aspen Campus, Water's Edge, and Lakeview Spine. And although it's not Memorial property, Creekside has 8 Memorial facilities. In all, the Virginia Mason Memorial Family of Services finds itself in 36 different locations throughout the greater Yakima area. One of these is 15 West Yakima Avenue, the old Holtzinger warehouse and office. Remember the donated property? What goes around comes around. Memorial's like the human beings it serves. It is organic, it is alive, adaptive, and ever-changing. Chapter 7, Grow Your Own. To fulfill the unwritten contract, Memorial must have skilled, quality people. Some can be recruited into the community, but the vast majority of the non-physician healthcare staff must be grown locally. To do that, Memorial for decades has spent much time, effort, energy, and dollars partnering with others to create and maintain health career educational programs right here in Yakima. Memorial has been active by serving as an initiator, investor, clinical training site, and scholarship underwriter. Nurses training has been a major focus. Partnerships with YVC, WSU, and Heritage University have provided for associate, bachelor, and master degrees in nursing right here in Yakima. A program for radiology technicians at YVC, an advanced degree for laboratory technology at Heritage University, and a clinical pharmacy program at WSU have all proven to be valuable partnerships. Since 1975, Memorial has worked with the University of Washington's Medical School to sponsor the Family Practice Residency Program. And Memorial played a major role in the early development of the College of Medicine at PNWU. Memorial's $1 million investment was important funding in the early years of the medical school. Growing our own in partnership with local academic centers, another facet of the gym. Chapter 8, Memorial and Physicians, the Changing Medical Model. In simplistic terms, the acute care hospital is the extension of the physician's office. When a patient can no longer be diagnosed or treated in the physician's office, the hospital becomes his or her workshop, and through laws and regulations, only a licensed physician has the right to admit a patient to the hospital for this advanced diagnosis and treatment. No hospital, no advanced resources. No physician, no need for a hospital. A pure, essential relationship. When Memorial opened in 1950, most of all of the physicians were a solo private practice model, a one-person business entity. 20 years later, the picture was mostly the same. However, two little movements occurred. First, in the emergency room coverage. In the old model, every physician on Memorial's medical staff had their turn to voluntarily cover the ER for a 24-hour period of time. The new model became a small group of general practitioners who contracted with the hospital to cover the ER 24/7, 365. The second modification was that some solo practitioners in various specialties began to form into small partnership groups. Up until the 1980s, all physician practices, solo or group, were private physician businesses, with the exception of the community health clinics, farm workers, and neighborhood health. But with the retirement of 3 psychiatrists and with no recruitment by them of new physicians to assume their practices, the private physician model changed. Inpatient medical services were important to the community. Some entity needed to hire and employ the specialty. Enter again the unwritten contract. Memorial concluded that it had to enter a new territory and thus employed the replacement psychiatrists. In the 1990s, the medical model took on a whole new profile. Driven by changes in federal and commercial health insurance payments to providers, physician practices were facing a crisis. For the first time, family physicians were saying, I want to practice in Yakima, but I can't afford to stay in Yakima. Family practice physicians needed help, and this community needed family practitioners. Enter again Memorial's unwritten contract. If Yakima was to be an attractive community for people to stay and to move to, a solid, stable medical community was a necessity. Memorial took another step towards vertically integrated organization, with primary care physicians joining Memorial's family of services. The first 2 decades of 2000 saw more practices in economic crisis. Specialty practices were voicing the same theme. Want to stay? Can't afford to stay as an independent business model. During this time, some practices joined Memorial Physicians Organization, and some were part of a new creation, a medical clinic owned by Memorial, where it contracted with a group of physicians to provide a specialty service in that clinic. Examples would be Yakima Heart Center and Yakima Urology Associates. This new direction over the last 30 years brought relative stability to Yakima's medical community. It meant, however, economic challenges for the Memorial organization. Because the dollars that in the past went to new expanded facilities and programs would now be needed to help support a more stable and reliable physician community. This new facet of the diamond has been delicately crafted so that the professional judgment for patient care remains in the physician's control. Chapter 9, Numbers. Healthcare expenditure is a significant part of America's economy, and at the local level, gaining control over costs has been a major focus of Memorial for decades. Memorial needs $1.3 million per day for operational expenses. That totals $475 million annually. About 60% of that, or $270 million, goes for salaries, wages, and professional reimbursement. That's $270 million annually that is put in the hands of Memorial employees, contract employees, to spend as they want. Economists have defined a phenomenon called dollar turnover factor. That is, the number of times some portion of money changes hands within an economy. They have calculated the turnover factor to be 5 times. For example, a nurse gets paid and he buys groceries. The grocery clerk gets paid and she has her hair styled. The salon stylist gets paid and he has his clothes cleaned, etc., etc., etc. The memorial dollar turnover is significant. $270 million annual payment to staff multiplied by the factor of 5 equals well over $1 billion that ripples like a series of waves throughout our economy each year. We all agree medical care is expensive. About 20 years ago, the School of Public Health at Dartmouth College began a study, and it looked at the variation of medical practice and associated costs by regions of the U.S. It was called the Dartmouth Atlas Project. They defined 306 hospital referral regions in America. Now, Washington has 6 of those. They're Yakima, Tacoma, Spokane, Seattle, Olympia, and Everett. Using Medicare data, Dartmouth showed that for similar medical conditions, there was considerable variation in treatment protocol and considerable variation in Medicare payment throughout the United States. For 20 years, the Yakima Hospital Referral Region has consistently scored in the lowest quartile in Medicare payment, translated lowest cost, while scoring high in quality of care. In the most recent study, out of these 306 hospital referral regions in America, Yakima was in the lowest 5%, actually the 16th lowest in the nation. Around the same time as the Dartmouth study began, the College of Public Health at Ohio State University created a financial ratio called the Community Value Index. Its purpose was to measure the value that a local hospital organization provided to its community. 4 factors were measured: quality of care, cost to operate, charges for services, and reinvestment in itself. A good CVI would score high in quality, low in cost, low in charges, high in reinvestment. There are over 6,000 hospitals in America. The Ohio State University created the Community Value Leadership Award to recognize the 100 best performers in quality, cost, charges, and reinvestment. Yes, Memorial has received that award, as has Virginia Mason Medical Center in Seattle. In 70 years, Memorial has received 4 national recognition awards, 3 from the American Hospital Association and 1 from the Fortune Magazine Corporation. The American Hospital Association awards were the Nova Award for Innovation and Collaboration in the Creation of Children's Village, the Circle of Life Award for its innovation in palliative and hospice care in the creation of Cottage in the Meadow, and the Foster McGaw Award for the comprehensiveness of services provided to the community. The Foster McGaw Award came with a $10,000 prize. Memorial took that money and donated it to the city of Yakima to improve the quality of water supply to parts of the city in order to improve oral hygiene in thousands of households. The Fortune Magazine Corporation Award was not just for hospitals, it was as one of the 100 best companies to work for in America. Of the 6,000 hospitals in the U.S., she is the only one with these 4 distinctions. Others throughout the United States have seen the sparkle that emanates from the facets of the Yakima gem. Chapter 10, Finding a Strategic Partner. 5 times during her 70 years, the Board of Trustees and management have had conversations with other organizations about some type of coming together. 4 of those conversations were with the Sisters of Providence. In 1986, 1990, and 1994, leadership from the Sisters of Providence, Seattle, and leadership from Memorial met to have come together conversations. But those are stories for another time. In the winter of 2003, approached again by the Seattle executives from the Sisters of Providence, Memorial was presented with a similar theme: come together for the good of the community. Conditions had changed. With a recent history of negative operating margin, and a $65 million bond debt that was screening financials, and a facility in need of substantial infrastructure attention, the board of directors of the Sisters of Providence Healthcare had decided to withdraw from Yakima. Several conversations took place in December of 2003. For the coming together to work, each party had a very tough task. The Sisters of Providence had to be very generous. They had to take the $65 million debt with them as they left Yakima. And Memorial had to be very courageous, as they would have to take on the enormous challenge of merging the two organizations, in addition, the expenses of refurbishing a second facility. In early January 2004, Memorial learned that the Sisters of Providence were selling their assets to a for-profit hospital organization headquartered in Tampa Bay, Florida, and that was HMA. Now, fast forward to 2012. Everything has a context, and the context of something is an important factor in decision-making. The context for Memorial in 2012 was the Great Recession was still a real part of our lives. It was also a time of great disruption in medical economics and medical system organization. And third, HMA had sold their Yakima Toppenish facilities to the nation's largest for-profit hospital system, which also had a major hospital medical clinic in Spokane. And the future of standalone nonprofit community hospitals in a two-hospital town was growing more precarious. While Memorial was still financially okay, the Board of Trustees started having conversations about a plan B. An analogy began to emerge. Picture the pioneers of the mid-1800s as they looked to the west from St. Louis and wondered how would they cross into that new territory. Would they travel the Oregon Trail alone in their wagon, or would they join a wagon train? If they went alone, they realized they needed to be rich in resources, extra food, extra oxen, extra wheels, extra. Because they had to depend upon themselves to handle the many adversities they could and would face. If they joined a wagon train, would it be a large one? Realizing that should they have a problem that would delay the whole train, the wagon master most likely would tell them the train needed to move on and that they would have to wait for the next wagon train and join it. Or would they join a smaller wagon train, where the success of the wagon train depended upon the success of each member? After many months of conversation and investigation, another seminal decision was made. The smaller wagon train model was chosen, and the Virginia Mason Medical Center organization was selected as the best traveling companion. This new strategic partner shared common values, had a similar personality, focused upon quality patient care, provided for the right amount of local decision-making, focused upon management models that worked to lower costs and make healthcare more affordable, and had a solid organizational model for the future, a model which better aligned physicians and hospital services so that healthcare could be more and better clinically integrated. And so, the magical Memorial hammer and chisel now had some additional minds and hands to continue shaping her into a gem. Epilogue. Now fast forward to July 2020. The context for Memorial has changed. With the bankruptcy of Astria, Memorial is now the sole major healthcare system in the Yakima area. And Virginia Mason Healthcare System has announced its intent to merge its Seattle and Yakima organizations with a larger healthcare system that currently serves the Tacoma area. That's the Franciscan system, consisting of 10 care facilities. The Franciscans are also part of a larger system, one that is in 18 states, and it's called Catholic Health Initiative, and it's headquartered out of Colorado. It has about 100 care facilities. And CHI is part of a national system called Common Spirit. It is headquartered out of Chicago, and it has about 700 care facilities.
Needless to say, it sounds like a rather large wagon train. The purpose of today's story was to visit and celebrate the past 70 years. What the recent development means to Memorial and Yakima is for others to communicate. All I know is that Memorial is a work in progress. She always has been and will be. The process of becoming has no end. She was given birth by a few visionary people who took up their hammer and chisel for the initial shaping of their diamond in the rough. They were followed over the last 70 years by many, many others, each taking their turn with the hammer and chisel and to craft new facets of this community gem. A gem that over the last 7 decades has attracted hundreds of very skilled professionals, been an economic engine for our community, received national recognition, never lost its focus on service to its community, and has, without hesitation, been diligently trying to fulfill its unwritten contract to its community. Whatever the outcome of the current developments, I certainly believe the crafting of the gem will continue and the unwritten contract with the community will perpetuate. Happy anniversary, Memorial.